Get the whole story. Democracy embodies responsive and responsible governance, rule of law, human rights, and civic participation. Join us on Monday, 13th December 2021 from 9 a.m. on KTN News as we discuss the gaps between political practice, the Constitution, and rule of law, the relevance of civic space in a democratic society, and voters' responsibility, youth apathy, and activism.
The thinking behind the solar power was really a realization that on a number of facets we needed to improve certain things in our business. Number one, we needed to look at the environmental aspects. Being a big power consumer, we needed to see how we can be green and be more friendly to the environment. Secondly, because we consume quite a lot of power because of our facility, which includes a number of studios, printing presses, and quite a number of other equipment we have within the facility. Our electricity bills were quite high, and so it was important to really look at solutions that could offer better outcomes in terms of managing the costs. So the project is already ongoing. It's nearing its completion. What we have is a lot of flat roof surfaces within our facility. So what we have done is we have installed solar panels across a number of the flat roof surfaces that we have around the main building and also the other auxiliary buildings, and we are able to put quite a number of panels on top and then be able to deliver that straight to our central powerhouse. And then the system we have implemented is an intelligent system that is able to gauge how much power we're getting from solar and how much we need as an addition to draw from the grid in order to meet our demand. We are looking at a project that is going to serve us for the next 25 years. We have done this with using partners who are experts in the field, and it's on a PPP model, which is really a model that works both for us as a business and also those who are specialists in the field, in that they can also sustain their businesses in providing clean power.
KTN News. Get the whole story.
Did you know that the food you eat could be the reason why you're not responding to treatment? Well, doctors say that this could be as a result of antimicrobial resistance. My name is Chebet Birir, and on this episode of Health Digest, we tell you why doctors are terming antimicrobial resistance as another pandemic. Dr. Victor Yamo is a farming campaigns manager at the World Animal Protection. He explains in detail what antimicrobial resistance is, how it happens, and what we can do to stop and prevent it.
Antimicrobial resistance is essentially a situation where drugs are not able to do what they are supposed to do. By drugs, I mean antimicrobial is a broad term that encompasses a series of products. Number one is antibiotics, which are used for treating bacterial diseases. Then we have antivirals, which are used for treating viral conditions. We have antihelmintics or dewormers, which are used for treating worms. And then we have other categories of drugs, but antimicrobial is a broad term that encompasses all of it. So in antimicrobial resistance, a situation where the chemical that we use, it can be a synthetic chemical or a natural chemical, is not able to treat the disease that it's supposed to treat. So essentially what happens is the organism that it's supposed to work against develops resistance, either because of misuse, overuse, or something.
When microorganisms become resistant to most antimicrobials, they are often referred to as superbugs. According to the World Health Organization, this is a major concern because a resistant infection may kill, can spread to others, and impose huge costs to individuals and the society.
Diseases are caused by certain organisms, bacteria, virus, protozoa, which I don't think is the major thing to look at. The major thing is then to understand how these microbes, as you call them, react to certain drugs and how then they develop resistance because of certain things we do in certain situations. When you go and buy chicken or meat, it already has its natural organisms on it. I'd prefer to call them organisms than microbes. And these organisms, some are good. Yeah? If you take samples, some are good. They're good organisms. They're good. They're bad ones. Our challenge is with the bad ones, and that's what we need to critically look at. And so meat, when it's slaughtered, comes into contact with organisms, which then can be transmitted to human populations. And depending whether that organism has resistance, then that resistant gene can then be pushed into human populations.
The possible ways of getting infected with these dangerous organisms could be what is in your plate and the water that you drink.
I think the important thing to look at in terms of eating chickens is, or any meat for that matter, is whether it has been inspected and has gone through the proper process of slaughter, inspection, and transportation, because at any of these points, certain things could go wrong.
According to Dr. Yamo, these microbes end up in our diets largely due to mishandling of livestock and poultry.
When you see a chicken being carried upside down on a motorbike, a lot of us don't think about it, but in reality that animal is going a lot of stress. A stressed animal, just like you and I, when you're stressed, you tend to get sick. So when you stress the animal, you end up in a situation where the animal is releasing certain hormones into the meat or into its body, but it's also ending up with most likely getting contaminated with disease-causing organisms. When you slaughter that animal, two things happen. One, the animal will not be tender because it has been stressed. So the stress hormone causes the meat to become a bit tough. But the second thing that happens, the organisms that were in the animal then get into the meat. And that meat doesn't last very long if you don't refrigerate it or keep it well. So those are the things people need to look at. And from an organizational perspective, it is important to understand that there's a connection between how you treat the animal and what ends up on your table, whether it's good quality, whether it's poor quality meat for that matter.
Daktari, antibiotics used in animals contributes to resistance problems in human beings. How does this come about?
When you feed animals with antibiotics, farmers have then discovered that because our environment is not good, we then give the animal antibiotics. And unfortunately in this country, you can walk to any agro-vet or a pharmacy and buy antibiotics, which are supposed to be prescription-only drugs. When the farmer buys that antibiotics and feeds it to the animal, the antibiotic ends up in milk, it ends up in feed, in meat, and it ends up in eggs. And there's a lot of research that's been done around that. Essentially then what happens is that the consumer is eating products that are contaminated with antibiotics. So you're getting low dose of treatment of that dawa. When you finally get sick, that dawa will not work because you've been consuming it in meat, milk, and eggs.
What practices do farmers do that contribute to microbial resistance?
Any farmer who's using any animal to produce meat or milk or eggs, it is important that that animal is managed properly, because if you mismanage that animal at the farming or production level, then you have a ripple effect on the quality of product and the productivity of the animal ultimately. And so the farmer loses, but the consumer also ends up with a relatively poor quality product.
There are several ways in which farmers can prevent antimicrobial resistance.
The animals have what is known as freedom from hunger and thirst. It means that the animal must be fed properly, but must also be given good quality water. And let's just start with the water. If the animal is given poor quality water, and the rule of thumb is that the animal should be given water that you and I can drink. If you can't drink the water, don't put it in a production system. The reason why you can't drink the water is the same reason why the animal cannot use that water. So for instance, if the water is contaminated with bacteria that causes stomach upsets, it is going to affect the animal. But the animal is also very interesting how it works. The animal will concentrate the same bacteria and put it in milk or put it in the meat. And so when you slaughter that animal, the same bacteria that you're avoiding in the water will always be in that animal's meat. And so you'll end up with what you're avoiding from the water coming onto your plate through meat.
Agricultural societies, farming groups, and other organizations also have a role to play.
From an organizational perspective, it is important to understand that there's a connection between how you treat the animal and what ends up on your table, whether it's good quality, whether it's poor quality meat for that matter. And those are the things that as an organization we're beginning to look at and trying to sensitize the general public about. That if the animal is mismanaged, then you end up with a poor quality product which might have negative impacts on you as a consumer.
Whatever food that animals consume could also be another cause of antimicrobial resistance.
Animals must be fed with feed that meets its physiological status. The way you feed a chicken, a day-old chick when it's young, is not the same way you feed a laying hen for that matter. It's just the same like you and I. The way we fed you when you were born with your mother's milk is not the way we feed you at this stage. And the reason that is done is because at each stage your nutritional requirement is different. And so if the animal is fed with poor quality feed, the animal does not perform well. It produces less product, productivity is affected, but it also produces poor quality product. And I'll give you other examples. If the feed is also contaminated, and I'll give you classical examples that we see in this country. When maize goes bad in the silos, what do? We tend to feed it to animals. The reason why we think the animal is the right place to go to is a mystery for some of us. But the critical thing to understand is when maize goes bad, it has certain fungus that has grown on it that produces certain toxins. If you then feed the animal with the same meat, those toxins will end up in milk or in eggs or in the meat of that animal. And that has an impact on humanity, the consumer. If you feed the animal with maize that is contaminated with bacteria, that bacteria will go through the animal and will end up in your plate. If that bacteria is bacteria that is resistant to certain dawas, that resistant gene can then be transmitted to human population. And that is why it is very important how you manage the animal at the animal level, because then you can control a lot of diseases at the animal level where it's cheaper and it's easier to manage it.
Having that, the sprouting, the mushrooming of pharmacy shops, which a number of them are not run by qualified health professionals, and therefore they would very quick, we say the quick solution whenever someone comes with symptoms which could possibly be viral is to give an antibiotic. Usually we say in practice that if you give an antibiotic, if you have a flu, then you'll get well in 1 week. If you don't give one, you'll get well in 7 days. So that assumption that it is going to run its course and just fizzle out, we don't have that patience. You want to feel like you're doing something about it.
According to Dr. Yamo, farmers should avoid taking shortcuts when it comes to treating their animals and releasing them to the market for consumption.
I think it's a lack of understanding, and again, a very good question. It's a lack of understanding of the impact of what you are doing. Yeah? Vets are available. If you think vets are expensive, try treating yourself from a disease that is resistant to an organism, to a dawa. Remember that World Health Organization states that annually we are losing 700,000 people dying from conditions that cannot be treated with dawas that we have. That is the cost of what you're trying to save. When the farmer is taking the shortcut, he's forgetting that ultimately he's part of the process of generating antibiotic resistance. But there are certain things that farmers do that I think are lack of understanding that we need to then address. Why do we need antibiotics in a production system? As an organization, we are saying 70 to 80% of the antibiotics that are used in production systems are unnecessary. If you wash your chicken house well, or your pig house is good hygiene, you give it good quality feed, you give the animal good vaccination, you ensure that the animal is in a comfortable environment, you ensure that the water that the animal is drinking is clean, you will produce chickens without antibiotics. Antibiotics from an organizational point of view are being used to mask poor production systems. They're being used to hide the fact that we have poor hygiene in our production system, to hide the fact that the ventilation in our chicken houses is not good. Half of those chicken houses, you go in, there's this ammonia smell that hits you. Imagine that chicken is staying in that house for 6 weeks. It has nowhere to go to. And those are the reasons why we then have disease conditions going through. If you cannot get a vet because you think it's expensive, counties have veterinary services which are supposedly offering relatively cheaper veterinary service. And so I think what farmers need to understand is that the cost of not engaging a vet is relatively higher than the cost of taking the shortcuts. That's one. Two, there are certain things we've developed that then propagate some of these things. One, farmers have this habit that when the animal falls sick, I ask my neighbor, because I think it's a faster way. Then what we tend to do, and I think it's mirrored in human populations, the farmer asks the neighbor, oh, ulitumia dawa gani? And the neighbor gives him a certain drug. Unfortunately, the conditions that the farmer is undergoing might not be the same, so the drug might not work. And so it's cheaper and easier to just go and consult a registered, private, technical person who can give you proper advice. And that is something that farmers need to look at.
According to experts, some farmers also make the mistake of releasing animal products to the market before they finish their respective treatment regimens.
From a farming perspective, when the animal is sick and it's being treated, we have what is called a withdrawal period. A withdrawal period is when products from that animal should not be consumed by humans because the dawa is in the animal products. If I give you antibiotics, it will get into your blood within 6 to 12 hours. And once it's in your blood, you'll secrete it in milk, you'll secrete it in eggs. And so each dawa has a withdrawal period, a time which products from that animal should not be consumed. But what happens in this country, we do not observe those withdrawal periods. So animal is being treated for a bacterial condition, but the milk is still being sent to the consumers, and the consumer then ends up being exposed to the dawa, and that means resistance is being built. So holistically, we are saying we just need to start changing certain things and obeying the law to ensure that the animals, to ensure that antibiotic resistance is reduced. But the big thing for us who are in farming communities is treat the animal well. Ensure that animal welfare is catered for. Give it good quality food, good water, ensure that it has good spaces with good ventilation, and then ensure that you are observing hygiene and sanitation, you're doing proper vaccinations, and you'll never need antibiotics in your production system.
You as a consumer also has a role to play in ending antimicrobial resistance.
I think as consumers, we need to start asking ourselves, where are these products coming from? What kind of production system we are coming from? Just to then bring it home so that you understand. Last year we did a survey. We went to supermarkets, the big 6 supermarkets in this country, and we bought meat, predominantly chicken and pork, and took to Kemri, just to try and find out what is coming with the product that you then consume at home. And one of the things that came out is, out of about 90% of the products had microorganisms, what you call the microbes, on the product. And as I said, not all of the microbes are bad. The challenge was that 30% of those microorganisms were microorganisms that we call superbugs. And superbugs are simply organisms that are resistant to 3 or more antibiotics. And so you're having a situation where you're buying from your supermarket a product that has organisms that are resistant to 3 or more antibiotics or drugs that we use. And so what then happens is that you end up in a situation where we are possibly transmitting the resistant gene from the meat that you eat to the consumer that consumes that product. And those are some of the things that we say as an organization we need to look at and refocus how we manage production so that animals are treated well, and what then ultimately comes out is good quality product that has no antibiotic residues, has no antibiotics, and has no organisms that are resistant to antibiotics.
Antimicrobial resistance has become rampant all over the country, with lack of awareness among farmers, together with policies on agriculture that have not been fully implemented. Many farmers lack the knowledge on the risks that come with poor farming methods.
There is no difference between antimicrobial resistance in animals and antimicrobial resistance in humans. People forget that it is the same dawa we are using. Yeah? If you go and for your common cough, you go to a pharmacist and ask over the counter to be given tetracyclines or penicillins or something. It's the same tetracycline, penicillin, aminoglycosides, whatever that we use in animals. The difference is the carrier, but the product is essentially the same. So when you're developing antimicrobial resistance at animal levels, it is the same thing that you're doing at human levels, because the dawa then doesn't work at both levels. And so from a production perspective, antimicrobial resistance tends to occur in intensive farming systems, which is basically chickens, pigs, and dairy production systems, which then, if you look at this country, mirrors the high potential areas. But rampant misuse of drugs occurs across the country. If you go down to the harsh north, the farmers are still injecting animals by themselves. If you go to Masaini or out in the northern parts of this country, it's the same thing. So essentially, I would say it's a problem that occurs through the whole nation. It's something that we need to look at holistically, and that's why the World Health Organization, World Organization for Animal Health, and Food and Agriculture Organization then declared that we needed to have a World Antibiotics Awareness Week that happens once every year to sensitize people on responsible use of antibiotics, irrespective of whether it's human, animals, or in the environment, because part of it then seeps into the environment and ends up contaminating the vegetables that we produce and eat.
According to the World Health Organization, mitigating antimicrobial resistance will have a huge impact on attaining 6 of the 17 Sustainable Development Goals. It is predicted that an additional $1.2 trillion in health expenditure per year will be incurred by the year 2050 as antimicrobial resistance becomes the next headache for governments, families, and individuals.
We have about 2.8 million people who either suffer from an antibiotic resistance infection, and it can contribute to more than 35,000 deaths annually. We have the challenge locally in being able to collect the correct data, even collecting data to know what is our current scenario. So we can just hazard that probably 10 to 15% locally of the infections would be attributed to AMR, but we have that challenge of poor collection of data, so we cannot say that we'll take those figures to the bank.
One of the things that happens in this country, you can buy antibiotics over the counter. Contrary to the law under the Pharmacy and Poisons Act, Cap 244, says antibiotics are prescription-only medicines. Same applies to veterinary. If you look at Veterinary Medicines Directorate regulations, it says that antibiotics are prescription-only drugs. But what happens? A farmer walks to an agrovet and we sell dawas. Then unfortunately, we're also selling reserve drugs. Antibiotics are classified by World Health Organization into certain categories. There are the priority drugs, there's the common drugs, and then there's the reserve drugs. What is happening is I can go to an agrovet and buy what is a reserve drug in human medicine and give it to my chicken. It means when somebody who's been consuming products from that chicken falls sick, he's already at the top level. Reserve drugs are the ones you use when everything else fails, but you're using them. And so those are some of the things we need to be looking at. And those are the risks why we are telling you, when you have a common cold, kunywa dawa. Forget about dawa ile, the mixture of honey and something. Forget about antibiotics. Antibiotics don't help in common cold situations. There are certain things that you don't need. So that's part of what we are looking at. The second thing is, how do we use these antibiotics? I fall sick. I use it. I'm told take it for 5 days. The 3rd day I'm well. I stop using it. The same applies to animals. The animal is sick. We give an antibiotic that is supposed to cover the animal for 7 days. On day 4 or 3, the animal is well, the farmer stops using the dawa. So essentially what you do at that point is, there are certain, you've just selected the weak organisms and killed them with the dawa. The strong ones that have developed resistance remain. And so the next time the animal gets sick from these organisms, they're already sensitized because the last time you didn't do the full treatment.
So what are the experts doing to ensure that we put an end to antimicrobial resistance?
In Kenya, we have a National Antimicrobial Stewardship Interagency Committee, which brings together health workers both from the human health field and animal health field. And I think they also have support from the environment. There are colleagues who manage the environment in looking at what interventions can we put targeting these various groups, those in human health, the healthcare workers, the vets, the agriculturalists, and also those concerned with food and the environment, in trying to look at what can we do in terms of policy documents. So there's a lot in that regards of creating policy, creating awareness. There's also a lot of trainings around that field. The challenge has now been in bringing these trainings now to the community setting, where now the general, say wananchi, the general person at home to be able to appreciate that. There's also been also some programs where they have engaged the public, where the Ministry of Health has gone about engaging the public to just have the idea of what health-seeking behaviors they have, how do they how do they interpret instructions with regards to the medicines they are given. We have had documentaries on the same barazas, but we still need to put a lot more effort, particularly targeting those who I would say maybe middle class and upper class, who tend to be the ones who demand a lot the use of antibiotics. Because if you have a flu, which is generally viral, the patience to wait for it to run its course. You'll find that those who are middle class, upper class, they do not have the same patience. But if you tell somebody else, probably in the, I would want to say maybe in the other lower social economic sector, they tend to believe you more. But we still have a challenge in that area because there are a number of these small shops, the duka la dawa, that are sprouting all over because the assumption that you make more money in running the pharmacy shops.
As a farmer, remember that you're producing in a global food system, and the global food system is becoming very strict on what is being sold. Ask farmers who are selling products to these big high-end supermarkets or the big brand restaurants. The restaurants are beginning to do their own audits. And part of what they're looking at when they come to your farm is, are you using antibiotics recklessly? Because anything that has antibiotics should not be consumed. So while there's a public health concern around it, there's also an economic bit that you're looking at. With these big brands of supermarkets and restaurants coming into this country, their requirements on use of antibiotics is so high that a lot of our farmers will not make it because we have poor production systems that we are masking using antibiotics, and ultimately we will lose out that market. So let the farmers look at it from that two-pronged approach. It's about health, but it's also about the economics of the production system that you are in.
It is clear that we all have a role to play in ending antimicrobial resistance. It all starts with what you eat and what you drink. With continued consumption of poorly handled animals and plants, very few medicines will reverse our health challenges, and that is where the risk lies. Chebet Birir for Health Digest, KTN News.